there's some lightning around. So we are just thrilled to be able to share this space with you, and hopefully if you're joining in on your lunch break today, you'll be able to stay until the end, and certainly feel free to ask questions. There are a few housekeeping items that we will go through as well, but I wanted to really start off with welcoming everyone to the session today, and also start off with our customary land acknowledgement that we've done for the beginning of every masterclass, and something very special to us here in Canada. And so I'd like to acknowledge that this is sacred land upon which we are privileged to live and work. We're recognizing the deep connection and longstanding relationship between Indigenous peoples in the land of Southwest Ontario and of London, Ontario, where I'm speaking from today. We acknowledge the Anishinaabe, Haudenosaunee, Lenapehoik, and Chinanton nations whose traditional lands we're gathered upon today. And we're deeply grateful to have the opportunity to be in this place. And so for housekeeping items today, we've turned off the chat. We will be using the Q&A today. The session is being recorded, and the introduction will be followed by about a 40-minute presentation, give or take, and then we'll spend some time with Q&A. And the masterclass was developed with input from our scientific planning committee. So a large thank you to Dr. Eric Wong and Dr. Sadia Jan, who've really helped bring this to what it is today. And again, what I would say is with the Q&A, please do feel free to put some questions in the Q&A. What we've been doing so far through the masterclass is really just answer these questions at the end, so that we will come to them at the end. If you do see a question in that box where you'd like to kind of upvote, essentially you can like the question, and that will put it in essentially priority sequence for us. And so I have the pleasure now of introducing our speaker today. So Tracey Carr is a bariatric consultant and a patient advocate for people of size. For more than 20 years, Tracey has offered independent advice to health companies and worked with staff, clients, and students to provide guidance and support for care provided for larger people. Tracey collaborates with a number of international companies and organizations and works to ensure that all people receive safe, dignified, and respectful care, regardless of their size. So Tracey, thank you so much for joining. Like I said, I was just in awe of and just what you've brought in terms of your insights and your expertise to this conversation discussion. I know we have a lot to learn from you today, so I will turn the microphone over to you, and thanks again for sharing that with us today.
Hi, everybody. Thank you so much, Jane, for that lovely welcome. It's an honour to be addressing you all today. So as we need to start with a few disclosures. So disclosure of financial support. You can see the slide there. Kristen's running the slides for me. So we've done everything we can to reduce bias, mitigate potential bias. And then I think, yeah, my presenter disclosure, I have no relationship with any financial sponsors. And is that the last one? It's a beautiful picture of Jane rowing that I can see. Right, just to sort of explain what I'm going to talk to you about, really, I'm just going to give you a brief history of me. So I'm English, as you can probably tell. I'm currently 205 kilos, which is about 451 pounds. At my very heaviest, I was 540 pounds, which is 242 kilos. But contrary to what lots of people assume about me, I grew up in a thin family. My family were fit and active, sports orientated, outdoor orientated. I was horse crazy as a child. So I had an upbringing full of healthy food, good portion control, lots of fresh air, lots of exercise, no junk food. And I think I was very fortunate in that. As I got older, I suffered intermittent bouts of depression and gained some weight, but I was still active. I was still swimming twice a week, playing badminton, etc. And then when I was 30, my partner died in an accident very suddenly. And my slight tendency towards depression sort of overwhelmed me. I had a, nervous breakdown was the expression at the time. And my weight just went up from there. It was around about the advent of online shopping for food in the UK, and so I could stay at home and I didn't work, and I could just get all my shopping delivered to the house. So I was comfort eating, but there was also an element of compulsive eating. I became obsessed with numbers, etc. And my weight just got completely out of control. It took me about 2 years to be able to go back to work, and I was working as an IT project manager. And I was over 500 pounds at that time. And then I carried on gaining because I was living this new life, you know, as newly single. I was trying to navigate the world in a body that felt very unfamiliar. Once you've started gaining weight, it's very hard to stop the wheel from turning in that direction and head back into a healthier place. Currently, my health is very good, and I touch wood when I say that. As I said, you know, I'm 55, I'm 5'9", it's about £1.75 m, and 205 kilos. But having said all of that, I work full time. I have a social life. I do all my own housework. I have hobbies and interests. I drive a completely unmodified car. My house has no adaptations in it whatsoever. My life is pretty ordinary. You know, I vote, I pay tax, I do all of those things. The only time my life is really complicated, finding clothes is difficult, and I fix that because I work for a clothing designer. So that's that one wiped out. Healthcare is the other problem. Healthcare is a formidable challenge. For every kind, caring, empathetic professional who's prepared to listen to what I have to say, I've met an equal number of people who feel happy to sort of put me into a category and, you know, write me off as someone who is so far beyond redemption that I probably can't be helped. And that's not a very encouraging place to be put. So recently I've had some healthcare problems. I had appendicitis. This obviously affects thin people as well. It's not solely a disease that affects bigger people. But it tells you something about how it feels as a larger person to be accessing services. I spoke to my GP. They said, go straight to the accident and emergency. It sounds like appendicitis. You need to go straight there. And to my other half's bemusement, the first thing I did was have a shower, get changed, and do my hair and makeup. And he was slightly mystified as to why I was bothering to put on a you know, office clothes and get my best handbag and put some lipstick on. And the truth is, I am fully aware that the way I'm treated by healthcare is frequently dictated to by my appearance. So by trying to look professional and as a person of worth, sadly, it affects how I am perceived and how I'm judged by healthcare professionals. If I can just apologise right now, I have a cat with me whose hobby is disrupting Zoom meetings. So apologies if you hear him butt in occasionally. My current exercise status, what do? I usually wear a Fitbit. The concepts that we're all told about doing 10,000 steps a day, I'll be honest, that's quite a stretch for me. There are occasions when I do it, maybe 3 or 4 times a month, but I aim to do 5,000 steps. If I can do 5,000, that's a good day, and anything over that is a bonus. I don't do any formal exercise. I walk. That is really my only form of exercise. That's partly personal choice and partly just the pressures of, you know, trying to run my life, etc. I appreciate that's an excuse, but that's how it is. I also do yoga at least once a day, and I try to do it twice a day, and that just gives me 20 minutes of stretching, and it's meditation, and it's really good for my mental health as well as for my physical health. So I work on things like trying to improve my balance, because as a larger person, your center of gravity is different, and the way that your body moves is different. And I think the subject of patterns of movement for larger people is understudied to a degree, because it's a very different experience trying to navigate in a very large body. Now, the title of this talk is to talk about the barriers to exercise. And when I was thinking about this, I divided them really into two categories, mental and physical. Obviously, when it comes to barriers, the first thing I say is, I'm speaking on my own behalf, but I also belong to a community of bigger people. You have to be 300 pounds or over to join. It's a very closed, secretive almost place on the internet, because we don't like other people joining us, because it's the one place that we feel safe to share honest concerns and interests, etc. We share things about clothing and about footwear and all kinds of ordinary things, as well as things that are specific to do with size. So I asked a few questions of my community, and I said, what's your attitude to exercise? How do you, if I say that word, what does it trigger in your mind? And lots of people came back with things about, the benefits to their blood pressure, to blood sugar control, issues with insulin, that it's good for your cholesterol, that it's good for heart disease, it's good for hopefully cancer prevention. There was lots of other things too. The plus size community is also recognises that it's a mood booster, that it's good for cognitive function. It can reduce anxiety. It can improve your confidence. Can aid sleep. All of these things. The plus size community is not unaware of the benefits. And I did actually read something recently where somebody was talking and saying, if we could invent a drug that gave all of the benefits that exercise gives and none of the side effects, because there aren't side effects to exercise, people would queue around the block to access this amazing wonder drug. So the plus size community, we are fully aware of the benefits that come from exercise. So what stops us? Well, I'm going to talk first about the mental barriers, because these are probably the hardest ones to kind of see in somebody else. And when I was asking people, what do you feel are the mental barriers that are stopping you from exercise, the word that kept coming out time and time again was fear. And that manifested itself in lots of different ways. So fear of failing, that they would attempt some exercise, a task, a yoga move, etc., and they would fail. Fear of hurting themselves, so that somehow in trying to use some equipment, trying to do something, that they would damage themselves physically. I'm very much aware that physical recovery takes me a long time. A few months ago, my cat pushed me down the stairs. I went 3 or 4 stairs. I went down hard, and I tore a ligament in my knee, and it's taken about 6 months to really get the mobility back. It's still not quite as good as it was, but that has absolutely, that has absolutely impacted the exercise that I can take. In terms of specific exercise like going for a walk, as well as the exercise I take unconsciously when I'm just sort of, shopping and working and doing all of those things. Fear of stigmatization. One thing I would say is, as a larger person, you're very conscious that you are visible all the time. We live in a society that is very biased against bigger people. it's hard to explain bias until you're on the receiving end, but I'm very conscious frequently if I'm in public that people are looking at me. It's not always hostile, I will say. Sometimes it is just curiosity, but it feels like my life is on show and that I am always being examined and studied. So the fear of stigmatization is strong. And the other side of that one, and the modern sort of side of that, is the fear of social media. There have been cases where, you know, bigger people have been filmed in public places, and that's, in this country, it's perfectly legal to do that. But they've been filmed and then the video has been put on social media. And even if the initial comment from the person posting the video is kind, the comments range from, you know, slightly supportive to absolutely vile. And any bigger person who reads those comments about another bigger person, you know, you personalize that abuse and that judgment very. It's devastating. It's devastating. If you're a generally nice person who's just trying to do their best to navigate through life, pay taxes, you know, pay bills, get the kids to school, all of those things, to suddenly think that you're subject to such judgment and hate is devastating. But there's a flip side to the social media thing, and that is sometimes bigger people, especially who are exercising in public, are stigmatized by a form of what would you call it, virtue signaling, I suppose, where somebody will photograph someone in a gym or whatever and say, oh, look at this person, aren't they amazing? And the person in the picture is just trying to get their workout done. They're just trying to do what they can for their body, and they don't really want to be held up as an example. It's, even if the comments start out as positive, it still feels, you know, intrusive and difficult. And also, we don't exist to make you feel good about yourselves. If you're beating a personal best in the gym, then good for you, but you know, that's the extent of my interest in your workout, and I would like that to be the full extent of your interest in mine, if that was the case. When it comes to the fear of causing harm to ourselves, the other major fear that affects everybody that I've spoken to is the fear of harming somebody else. So as an example, if we're in a clinical situation and we need manual handling to transfer us from, you know, bed to chair or whatever, the fear that a caregiver might damage themselves and possibly, you know, it could be a life-changing injury if they hurt their back or whatever, purely through trying to aid me to achieve something. That thought is devastating, and that thought is enough to make me resist being moved, for example. So even if it'd be better for my mobility to get me out of bed and into a chair, if my primary concern is that one of the caregivers it seems to be at risk of hurting themselves, then I'm just going to refuse to be moved. And you would need a really good relationship with me to get me to admit what was causing the problem and what I thought could be done to mitigate those fears. Excuse me. Apologies. So, yeah, the mental barriers to exercise are really about fear, all about fear. There are physical barriers which sound as though they would be obvious to everybody. So things like, you know, is the equipment in the gym a suitable working limit for me to use? But the barriers start before that. For somebody my size, or for somebody who is starting to exercise, it may be that doing, you know, 1,000 steps a day is quite an ambitious target. When I was at my heaviest, I would estimate I took probably around 500 steps a day, which in terms of health is terrible. But that means if I can make it 600 steps, that's an achievement. That's a 20% increase in activity. That's huge. So regardless of where we're starting from, we need to achieve more. But the physical barriers like equipment, etc., are compounded by things like the physical barrier of clothing. So it is very easy to find exercise clothing in smaller sizes. And the technological world has developed brilliantly. So there are these amazing fabrics that wick sweat away and keep you fit and your skin dry and comfortable, etc. But they don't make those garments in bigger sizes. They might make a token effort of going to sort of rugby player size, but they don't end up at a size that somebody like me could access. Clothes matter to us as a society, and you know, if you read an article about motivation, sometimes people will say if you want to kickstart some physical activity, you know, buy yourself some great new clothes, and it'll make the way you work out feel different, and it will encourage you. Exercise clothing for my size pretty much comes in black, and that is it. So there's no, it sort of sucks the joy out of it slightly. I'm not saying that somebody my size needs all of the incredible choices for every activity, but it would be nice if there was a little bit of variation. Things like supportive and wide-fitting footwear. You know, somebody who is only doing 500 steps a day will probably need wide-fitting shoes. They'll need to be shoes that are comfortable and durable, possibly shoes that are easy to put on and take off. All of these are factors. And, you know, as a medical professional, if you want to encourage your patient to exercise, I wholeheartedly support that. But even saying something as simple as go for a walk, you're asking your patient to have suitable footwear. You're asking your patient to have clothes that they feel comfortable in. And for lots of bigger people, that will mean something that makes them fairly anonymous. And larger clothes are very expensive in comparison to smaller clothes. You're also asking someone to brave the general public. So, for example, if I'm out for a walk, I would never listen to music, etc., because I like to be aware of my surroundings and to know if anyone is making a discouraging or hostile remark. So I can't sort of lose myself in a world of music while I'm walking. I wouldn't feel safe to do that, even though I live in a completely safe part of the world. There's also things, so if you invite your patient to come to a gym, for example, if they're only doing 500, 600, 1,000, 5,000 steps a day, it may be that walking from where they park their car in through the front door is 500 steps, 1,000 steps on its own. So you're asking for quite a substantial outlay of energy and enthusiasm and muscle power even before they've got through the front door of your establishment. You know, sports facilities can be huge buildings. If somebody's walked from the car park, does your larger patient have somewhere where they can sit down just inside the door? Does your facility have seating that is comfortable? Do they have seating with a selection of seating, some with arms, some without, etc., so a larger person can sit down? If you ask me to visit a facility and I have to park a fair distance from the front door, walk into the facility, and then walk straight into the activity centre, I would probably start feeling uncomfortable, and I would like somewhere where I could rest and maybe regain my breath before I undertake the next stage of the exercise. And we're only really talking here about the physical barriers. We're not talking about the mental steps and the determination that it can take. When we're talking about physical barriers too, frequently swimming is suggested as a really good exercise, and it is. But I have to say, I am pretty self-confident. I don't have any problems, presenting to an audience and talking about size and weight and all kinds of personal things. But I do not appear in public in a swimsuit. For me, that's not something that I can yet achieve, even though I recognise the benefits of, being able to exercise in a way that is not weight-bearing. Swimwear is very difficult. It's slightly easier for men, I have to say, because they can wear shorts and maybe a t-shirt. And with the advent of modest swimwear, it's slightly easier for women too now to feel more covered up in the water. But again, these garments aren't necessarily available for somebody my size. Now, on a personal note, I have to say that I have used the excuse of not having a swimsuit to avoid swimming for quite a few years, but I do have a swimsuit and I still can't make myself do it. So, swimming, for all its advantages, it does effectively require you to be almost nude in public. So that can be quite a challenging step for somebody to make. The other problem with swimming, and now we're back to the mental barriers of fear again, give consideration to what would happen to your client if they're in the swimming pool and experience difficulties, because lots of times lifeguard crews and equipment, etc., wouldn't be able to physically lift a patient my size out of the water, and that could be a very serious matter. Even therapeutic pools frequently have weight limits on the safety equipment that can be provided in an emergency. So if you're talking about your patient accessing swimming, please be aware of this. I can't imagine the publicity that would result, especially in the UK, from somebody being in a public place and stuck in a swimming pool that they couldn't get out of. The media is vile in this country, and things are published with the notion of being in the public interest when frankly they're not. But yeah, please consider safety if swimming is the option of exercise that you're pursuing. When it comes to exercise, one really important thing that I would suggest to you is please try and have a conversation that focuses on wellness and on well-being rather than weight loss. And the reason for that is sadly quite simple. Lots of heavier people find that the conversation about weight loss comes into every single conversation we have with healthcare providers. And it's possibly justified because it is possibly a serious factor, or it is a serious factor in our ongoing health. But if that's the approach that every single conversation starts with, it can cause somebody who's heard this endlessly throughout their life to just shut down and to not really listen. So try and approach the conversation from a point of view of wellness. Try and sort of sell the benefits that are instantly recognizable rather than the longer term benefits. So trying to sell the benefit of something like bone density, it's perfectly valid, it's perfectly justified, but it's a bit of a hard sell when every movement you make is potentially quite painful. So I would say instead focus on the sort of short-term benefits that exercise would bring, and they would be things about improving your mood, cognitive function, reducing anxiety. Also talk about the improvements of confidence that having better balance can offer. I can say with no doubt at all that every sort of maybe 2 kilos that I lose has an effect on my balance, because my body shape is changing. Every small increment affects my balance. And although weight loss is a positive thing for me and it's something that I am trying to achieve, knowing that the action you're taking is going to cause difficulties for your balance is almost counterintuitive. So you need to push that it will improve balance in the short term and improve your confidence to move. But all of these short-term benefits are an easier sell than making the conversation solely about weight loss. I would also say that no matter how small, or on a average scale, no matter how insignificant your workout is, exercise feels good to a big body as well as to a small body. I'm a fan of that endorphin release that you get from successfully completing what you started out to do. And I know that that's a factor in helping me achieve things in other areas of my life. So I might be alone in my bedroom wearing clothes that I would not appear in public in, and doing yoga really, really badly, but it still gives me a boost, and it still makes me feel better about my physicality. And I still get that endorphin rush that an Olympic athlete might get from a personal best. It's still a good feeling. So it's worth pushing through and helping your client to understand that all of these barriers can be overcome. I want to sort of talk a little about making sure you've got kind of bullet points to take away from all of this. But I wanted as well to tell you about a venture that I've only just found out about. And it's a gentleman called Jovino McLean, and he's in Manchester in England, very close to where I am. And he runs a gym, and that's not very unusual. We all live in a community where there's probably 20 gyms within our neighborhood. But he has a completely different approach. So as well as having facilities for bodybuilders and for, cardio athletes, he offers free training to disabled people, to elderly people. He works with clients with cerebral palsy or who've had brain injuries following accidents, and he does it all free. Everybody else pays, but people in need can access his services for free. And he calls his gym the Health Centre. It's called the J7 Health Centre. And I think that is such a good take on how to sell exercise to people who are possibly resistant to it. Make it about health, not weight. I was talking to Kristen before we started today, and we were talking about language, and she's done lots of research into the use of words and how they can shape the conversation and the outcome. So the fact that Jovino calls his gym the Health Centre, the J7 Health Centre, I think is amazing. So if you have time, I would wholeheartedly recommend that you look at his website. It's j7healthcentre.co.uk, and I was absolutely blown away by his attitude to helping people achieve more. Now, so far, I haven't seen a bigger person working out in his health centre, but I have reached out to make contact, and I'm really excited about the possibilities that he might be open to working with the plus size community as well as the disabled and the older adult community in trying to make exercise accessible for another group of disenfranchised people. So I'd recommend you look to that as an example of best practice on how to motivate people. I think if I talk now, Kristen, can we put the slide up about the barriers to change? And I'll just summarise some things. So the main barriers to change that I see are personal, institutional, societal bias. I've come across all three of these. Societal bias is obvious every time we turn the TV on, every time we open social media or print media. That exists. Institutional bias too, statistically larger people are more likely to be judged guilty by a jury. They're more likely to have larger fines when they access the legal system. And then I've also experienced personal bias, and I was in hospital recovering from an operation. I'd been in intensive care for 3 or 4 days at that point, and I was being pushed to eat, and I really didn't feel like it. I wasn't hungry, but I was being pushed to eat, and one of the staff pushed around a lunch trolley which had sandwiches on it, and the staff they kept stressing that I wasn't going to be able to get out of intensive care and I wasn't going to be able to get out of hospital until I ate something. So I thought, right, okay, I need to do as I'm told. I do try and be a good patient. So I asked the catering staff if I could have a sandwich, and the lady immediately replied, yes, of course. You'll want something low calorie. And her personal bias to assume that everything I consumed should be low calorie at every single circumstance was really upsetting to me. And on one level, she was right. There is no reason for someone of my size to be taking in excess calories. But at the same time, that's not what I was taking the food for. I needed protein, I needed fats, I needed to promote healing and to help my well-being, get bowels moving, all those good things. And her personal bias against larger people was quite hard to take. And actually, I immediately shut down and said, I'll leave it today. And it was another 24 hours before I ate anything. So, bias is hard to recognize until you experience it, but it is out there at all levels of society. And one of the barriers is making sure that we do what we can to address societal bias. We need to work even harder at institutional bias. So our business, our practice or whatever, what can we do to ensure that bias doesn't affect outcomes for larger people? We also need to examine our personal biases. And the thing about being overweight, if I was sitting in front of you and I was a functional alcoholic or a weekend drug user, it wouldn't show on the outside. Maybe it possibly would in years, but disordered eating shows on the outside immediately. So we're all open. People of size are judged immediately, which can be really hard. So once you've addressed the biases within your society, institution, and personally, one of the barriers that stops us exercising is the failure to establish trust. I need to trust you deeply to make sure that you have the target of my well-being at the front of your mind. We're not just talking about the numbers on the scales. Seeing weight loss happen is such an easy target to measure. It's absolutely instant. It doesn't require money really to judge. It just needs somebody on a scale. But that's not an effective measure of health. Somebody who is taking care of themselves, doing exercise, they might still be a person of size, but their health is generally going to be better than someone who isn't. So you need to establish a trusting relationship so your client can be honest about their level of expenditure, their level of exertion. And also recognise the unique fears that your patient faces. People of size face these barriers at every step. The visibility, the bias, the discrimination. Every large client will have their own sensitivities, their own strengths, and their own approach to a challenge. So always try and get their input and work with them. As I said at the very beginning, all the good things about exercise and what it does for your blood pressure and for insulin sensitivity and cholesterol. We all know that. People my size know it just as well as people who are thinner. So, work to establish the trust and make sure that your patient knows that you're trying your very best to understand their unique position. Kristen, can we go to the next one? And that is, it's just a few points that I've put up really as a primary care takeaway. So your large patients absolutely deserve the benefits of exercise. So please do everything you can to address any stigma, prejudice, discrimination, bias that might be standing in their way. Make sure that everybody in your institution knows that we're talking about well-being here. Losing weight is great, and that is my aim every single day that I wake up. But I can't make it the entire focus of my living. So I try and focus on my well-being and on, if all else fails, on maintaining a stable weight. I do want to lose, and I absolutely do not want to gain. but if I can just maintain weight, that's enough for me. So my well-being consists of, you know, mental, physical and spiritual, and they all have to be in balance. So look at finding ways to measure well-being, measure mood, measure the amount of control that your client has over compulsions, etc. The next point, please, bias, as I've already probably flogged you to death on, it exists at all levels and it must be addressed and overcome. Sometimes I address an audience and I will say, you know, hands up, everybody here who's the exact size and weight that they want to be and can maintain it without any attention or focus whatsoever. And there's always a couple of people who are in that lucky position, but not many. So the vast majority of us are dealing with our own weight and food issues, and we're bringing them into these conversations. So it's hard to eradicate bias, but at least recognize that you are probably biased as well, just like I am, and that we bring it to all these conversations. Another takeaway, obviously, appropriate environment, the equipment, the clothing and the footwear must be available. There are some links on my website that will give you a starting point, but as ever, Google is your friend. Just look for them. If your client is using shoes or, you know, exercise wear as an excuse, like me and my swimsuit, just Google, you will find a solution. Almost every body can be accommodated, even if it's not in nice fabrics and great colours and a flattering fit. There are options out there, so go find them for your clients if that is the barrier. You must recognise the fear, and living in a body this size is a scary thing. You know, I am never unaware of the issues that my weight is causing on a day-to-day basis. You know, I'm never unaware that a simple trip or fall could impact my health on a permanent basis, or at the very least cause me difficulties for months and months. And the very last thing I would say for you to take away today, hopefully, is celebrate absolutely every success. It doesn't matter how small. It doesn't matter if it's one single, you know, yoga move, whatever it is, celebrate it, because human beings respond to positive stimulation. Telling us we're ugly, we're fat, we're disgusting, we're a burden to society doesn't motivate anyone. And that's such an obvious thing to say, but so many of the population seem to think that we can be hated into being thinner people, and it just doesn't work like that. So celebrate every success, every positive action, and work with your clients, please, to help them exercise. That's the end of my takeaways. I'll just put up my website and my email address so you can contact me at any time. And I think we're going to move into the question and answer section now, because I've probably talked you all to death, as is my want. My other half says that I have a reinforced soapbox and I get started. So just to say, though, with questions, you can ask me absolutely anything. I've been talking to audiences for over 20 years. There's nothing you can say that is going to shock me, upset me. If you ask me something that I've only been asked something that stumped me once, and if you ask me the same question, I've got an answer worked out now. But absolutely ask me anything. I'm not here as your patient, and I'm keen to help in any way I can if there's anything specific I can help with. So I think, Jane, did you say you had some questions to start us off with?
We do, absolutely. And Tracey, thank you so much. I love it. I love the insight that you provided. We've mentioned before, and it's interesting. I heard some new things today, and I know that we've already had a few comments just about how even what you've said has really already struck a chord with them. I do have some questions. In fact, I have a lot, even just new ones that cropped up during your talk today. But I do want to start with our guests that have asked a couple questions. So Kyle is, so I'll just read it off of, and he did write this at the kind of midway point though, so I know you have addressed some of the questions that he's asked, but maybe if we could go over that as well. And I do have I have a raised hand, which from somebody else, and we actually haven't had that happen yet. So Keith, just hold off on 1 second. We may be able to pull you in. I'm not sure, or if you could write your question in the chat as well. But I'll just get to Kyle's question first. And he said, and we do have other ones coming in too as well. So this is great. So Kyle's saying, thank you for shedding light on this topic. This is something so pertinent worldwide. And I feel like all of us as physicians have admittedly shown weight size bias, and it's something so important to introspect on. As you said, it's important to take interest into the plus size community's interest rather than forcing our own thoughts on you. What would you advise a physician dealing with a plus size individual with poor physical health, and the best way to go about it with allied teams? He did follow up to say he does really love the idea of wellness and well-being, and the fact that terminology is so important. So you had a kind of address those as well in your talk, but I don't know if there's one other thing that you wanted to add or some other additional insights based on his comment.
Kyle, I'm so pleased that you acknowledge that, you know, bias exists everywhere. And I'm certain just by the fact that you asked that question that you're doing a great job for your clients, just the fact that you've, you know, recognized these barriers. But it's difficult to understand what living in this size body can feel like. So if there's something you're not sure, you know, establish the relationship and ask and say, you know, please be as honest with me as you can, and be honest with them. If you don't have an answer, if they ask you a question, it's fine to say, you know, I don't know if we can help you play tennis, but let's take the steps that get there. You know, it's fine to make a plan and then change it as it progresses. So yeah, just by asking the questions of ourselves, we're already doing better. So I think your patients are in good hands, Kyle. Thank you.
That's great. And we have two other questions that have popped up. And again, Keith, I see your hand up. What I might do is we'll answer the Q&As. If you can try to type it into the chat, fantastic. If we're still having issues, we'll try to see if we can just pull you into the conversation. So I'll start with Sonia, who's asking, do you have any specific strategies or resources to combat weight bias in providers? I see this in colleagues all the time and would love to be able to recommend some reading or other learning opportunities, for example.
Oh, fantastic. Be an ally, I think is what I can say. If your colleagues are entrenched in their bias, they're not going to want to read a document or to watch a video. So the only way you can really address it, I believe, in a meaningful way is call it out when you see it, call it out in that moment. So personally, the way I do that, and obviously as a large person, it's a slightly different perspective. But if I hear an unkind comment, my first question is, why would you say something like that? If I can turn the question back on the questioner and say, why would you make that assumption? Why would you phrase it in that way? And I think if you want to be an ally for bigger people, that's a good way to start. Just make it clear to your patients that you will always stand up for them if somebody is saying something out of turn, and make sure that all of your colleagues know that you will not accept hearing those kind of prejudices and you know, opinions voiced in your presence. The more people that we can get to be allies for any number of discrimination, the better we'll all be. So yeah, I would call it out when you see it, would be my advice.
Fantastic. Thank you. Simon has asked, can you comment on terminology? I've been hearing the medical community's move toward people with obesity and overweight has not been well received. So I think that kind of person first language, right? And I agree, some of this, I've heard that in other contexts as well. So that person first, but people with obesity or overweight, obviously let the individual patient lead, but plus sized, fat, large, obese, is there any general preference, one that's accepted in your online spaces?
Generally, online, we prefer plus size because it has a vaguely positive connotation. But obviously that's used in a fashion sense for, you know, people who are maybe 20 pound overweight. And in the plus size community, we use it for people who are sort of 500, 600, 700 pounds. Plus size is probably least likely to cause offence. People of size or people living with obesity, are also acceptable. And there's never going to be one term that's going to suit everybody. There is one term, however, that I am 100% determined to eradicate, and that is morbid obesity. We don't use such unkind terminology to talk about any other patient group. We don't talk about morbid cancer patients or heart patients. It's counterproductive, it's unkind, and I don't feel like the best description of me is dead fat. You know, as I said, I pay tax, I vote, I'm somebody's sister, somebody's daughter, somebody's other half. I've got more to my life than just fat. So I can just about accept morbid obesity in a clinical sense if you're 100% certain your patient will never get to read it or hear it. But in every other circumstance, I regard that as unforgivable, and I don't ever want it used. But yeah, plus size, people living with obesity, people of size would be the preferred terminology. Personally, I use the word fat, but you'd have to know your patient pretty well before you use that word. I've desensitized myself so it doesn't offend me, but I think plus size is a better bet for you.
Thank you. Yeah, that's great insight. So thank you, Simon, for the question as well, and for the others that have asked the questions. I think Kristen is going to try to see if she can have Keith speak at this point, bring him in somehow, who was the other person asking a question, I believe.
Yes, he'll just have to unmute himself. Okay. Sorry. Yep.
I'm not hearing anything, I'm afraid.
Yeah, no, I don't think he's yeah, I think you're still muted, Keith. So we'll see, there might be some technical difficulties while we're figuring that out. I'm just ask another question because it's interesting because I think from the perspective of many of the things that you brought up, we're also going to public spaces in terms of gyms and things like that, where the workout equipment isn't set up properly, or things about even clothing design, wearing comfortable shoes and things like that. I do have some questions about clothing design. I don't know if we'll run out in time, but I think those are just excellent points that probably a lot of us haven't considered. Just thinking about resources, kind of friendly resources out there. Do you find that things like for people who may feel more comfortable being at home, so in terms of exercise videos, for example, YouTube or things along those lines, do you feel like those are more accessible? And do you find that is it better to have other people who are plus size doing the workout videos, for example? I just curious about your thoughts about resources that, you know, physicians may be able to recommend, or healthcare providers may be able to say, go to this link or something along those lines.
It's an interesting one, because sometimes when I watch you know, a yoga video, for example, and they're usually gorgeously attractive, fit, live people doing things with their bodies that I can't begin to imagine. And it's inspiring on one level, but it's not motivating. So actually on my website, there is a selection of, you know, starting points to get from YouTube or from Google of people whose exercise ethos I admire and who have a body shape that would actually motivate me to think, well, if they can do that, maybe I can have a go. But in terms of exercise, it's far easier to exercise at home. You don't have to worry about clothing. You don't have to worry about public discrimination. You don't have to worry about the effort that it takes just to get washed and dressed and out of the house and to a facility. But set up a two-way Zoom session, you know, get your client to like check in. One thing I'd say about the plus size community is we're not always very supportive of each other. And you will find people who weigh, say, 500 pounds being really judgmental of people who are 600 pounds. So sometimes it is just easier and kinder to have people at home on their own doing the exercise that they can to the best of their ability. And I've worked with a couple of patients. One young gentleman. He was a teenager. He was very he was bedbound, and he was very anti the idea of yoga because he thought it was all fluff and nonsense. So to start his exercise, we started off with hollow dumbbells, and his first aim was to be able to reach his PlayStation by himself without having to get his carer to bring it to him. And by working a bit with the dumbbells, which to him felt more masculine and suited what his idea of exercise was, and then we moved into weighted ones, and now he's got a trainer, and from being able to reach his PlayStation unaided, his next aim is to walk, is to get out of bed. But you've got to start somewhere, and you've got to tailor what you're offering to the place that the patient is in at that time. So if I'd persisted in suggesting him do yoga, which is my preference, I think he would have parted ways with me a long time ago. But we're still in contact, and he's going great, and he wants to get fit enough to have weight loss surgery. So, you know, that's a really positive story, and I keep pushing him to put his story on the internet and inspire people. But at the same time, I completely understand why he doesn't feel able to do that yet.
Wonderful. So we have 2 more questions, and I have like 7 or 8, but I'm putting mine aside for now. We can talk another time. But 2 more questions that have come up, and we have 3 minutes left, and I'm sure we could talk forever for this because it's it's just a fascinating discussion. So thanks for everyone who's engaging as well. So Kyle's asking again in terms of probably kind of to piggyback on that question that we had. He was asking whether you feel that exercise personnel would achieve results by coming to your home so that you're in your comfort place essentially to exercise, or if coaches were doing a plus size group in the pool so that no other people around would be of benefit. I think you've somewhat answered that, right? That it can be a good thing, or it really depends on the context and the person, right?
It can. I think, you know, a class in a pool would be something I would feel open to doing, but I would want really strict rules regarding, you know, social media use, camera use, anything like that. Anywhere out in public, I do feel automatically on show. So the idea of having somebody come to my house and maybe start helping me to figure out ways to, you know, just things that help you stretch, things to help you breathe, and use that as a starting point, and always the focus on the wellness rather than the weight loss as a starting point. But you know, absolutely any exercise is good. So try anything that you can to get your patient to engage. And yeah, absolutely. I love the idea of trainer in your house. Perfect.
Yeah. So we'll wrap up with this last question. An anonymous attendee is asking about, as a physician with a leaner body type, I always worry that plus size patients won't be as receptive to my health advice because they won't see me as relatable. Is there ever a time you wish a healthcare provider would openly acknowledge this, or am I being egocentric to even question this?
No, I don't think it's egocentric at all. And it's a very valid point. I had a general practitioner who was absolutely fantastic with me, and but it was about a year into our relationship when he told me that his best friend was a person of substantial size. And when he felt able to share that with me, I felt I understood the reasons why he was so understanding and compassionate towards me. But no, I think it's great to acknowledge and say, you know, how does it feel for you? And just acknowledge someone. I have the utmost respect for all of you professionals and what you do for our health. It's amazing. But at the same time, I'm the expert of what this body can do and what this body can manage. So just acknowledge me as the expert of this body, and then help me work towards the body that I would rather be living in. But no, it's not egocentric. And yeah, I possibly would look at your fabulous fit physique and think to myself, do you really get me? But you can express it in the words. You don't have to put weight on to relate. Just express it in your words, and then I'd feel much more comfortable and inspired.
Wonderful. Thank you so much. It's just at the hour now, and I'm respecting everyone's time, particularly yours, Tracey, and I want to thank you so much for joining us. So 2 quick things to wrap up. So Kristen in the chat has put the evaluation form in the chat, and then if you have any questions, to please email her. And then I also just put the website that you mentioned, the health center website, and as well as yours. Oh, Kristen's already done it too as well. So that's fantastic. Thank you so much. And I love what you've also said about celebrating success, ways that we kind of strategies to overcome some of the barriers, and also help physicians be able, and other healthcare providers particularly, to be able to really provide just that's not just shared decision making, but also just shared dialogue and understanding, more centered around health than weight loss and things like that. I really appreciate perspective as always, Tracey, and thank you for sharing your stories. And I hope we can have you back on for another session, because this could go on for another hour at any point. So thanks to everyone who came during your lunch hour or wherever this finds you today. And I hope to see you at the next masterclass. And thanks again for everyone's engagement. I hope you have a wonderful day.